Welcome back to Jersey Matters. Lockdowns and restrictions are hard on all of us, but for people who are disabled in New Jersey, they can be devastating. There's a push right now for Governor Murphy to be more responsive to the disabled during the pandemic. One of those people pushing is Javier Robles, who is a professor at Rutgers University and director of health and wellness kinesiology. Thanks so much for taking some time to talk to us. I know that people with disabilities have special challenges when it comes to dealing with the pandemic. What are they?
There's a number of challenges, including access to PPE, ensuring that when people with disabilities go into hospitals or for healthcare during the pandemic, that they're giving equal rights to equal treatment, ensuring that they have access to food during moments of crisis, which we saw especially in the beginning of this, ensuring that they have access to workers or home care services, which is obviously a problem when, individuals work with multiple people.
We're talking about a second wave, which could lead to another shutdown. There's been a partial shutdown so far, but that's not going to get any better over the next few months. Are you counseling people with disabilities to prepare for that, to make certain that they have enough resources, both personally and when it comes to food supplies and medicine, to get through another possible shutdown?
Yes, we have a Facebook group where we talk to people, but with our recent report that was just released last week, we made 23 recommendations to elected officials and lawmakers that could ensure that people with disabilities at least have a chance of surviving a second wave. So we're counseling people with disabilities, as a group, but we're also asking our lawmakers to actually take action on some of these recommendations that this group spent the last 6 months on putting together. And, these recommendations really will save lives. If you're a person with a disability, you can only do so much, especially if it's a life or death situation for you to leave your house. If you have underlying conditions on top of your disability. So, if you're a paraplegic or quadriplegic, or, you have some other disability, but on top of that, you also have diabetes or something else due to your disability, then you're at a greater chance of contracting the coronavirus or COVID-19. So, we ask people with disabilities to really educate themselves. We ask them to share resources. We found, especially in the beginning, that no one knew where the resources were. So we had to go to each other to ask those resources. But now we're asking the lawmakers through these recommendations to really step up, include people with disabilities in your planning, ask people with disabilities what their needs are, because we know best what our needs are, and really engage our community so, we don't have to worry about whether or not we survive this second wave.
I'm not going to have time. People can look it up for themselves, I would hope, but I'm not going to have time to go through all 23 recommendations, but highlight them. Give me a couple of the most important.
I think some of the most important include recommendations about individuals with disabilities going into a hospital and making sure that there are enough resources, for example, ventilators or other life-saving measures.
Let me just stop you for a second, because I heard you say that the first time. Wouldn't that be everyone? Why just people with disabilities? I mean, some of these things would relate to the entire population, not just people with disabilities.
That's true, normally. So what we saw in the beginning of the pandemic in New Jersey was that, we didn't have a plan in the state of New Jersey. So we had some hospitals basically saying, including executives in these hospitals, basically saying, okay, we are in such a crisis that we are going to have to make decisions as to who gets a ventilator and who doesn't. So if we have to—
wait a second, so people with disabilities were at the back of the line?
People who had less of a chance of survival because they had an underlying condition would be put at the back of the line. Eventually, New Jersey adopted this thing called a Pittsburgh test by the University of Pittsburgh, which I won't go into, but it basically scales individuals on their chances of surviving this pandemic. the state of Utah got sued by disability advocates. They came up with a pretty comprehensive solution, which we would like the state to look at, where people are treated equally. So, that's a big problem, not just for people with disabilities, but also for people of color in the state of New Jersey, which tend to make up a huge proportion of people who have COVID-19 as well.
Of the 23 recommendations, are most of them that you just wanted to be treated equally?
I'll tell you what we came to as a committee of about 23 people was the fact that New Jersey or no other state really should be making decisions about, how people with disabilities live and how they die without us being in the room. And, it's been a pattern, not just in this administration. We think Murphy's doing a pretty good job considering, but, previous administrations, every administration has done things, made rules, and people with disabilities were not in the room. And we think that that's a problem, not just for parents of people with disabilities, but just generally speaking, you don't make recommendations for other groups and say, well, this is what you're going to get. You involve those groups. And we think that that's important. And if you have us at the table, hopefully we won't have a situation like, we've been presented with in the past.
Did you send this to the Murphy administration?
Yes.
You heard from them?
Yes. The Murphy's aide has said that she will be in touch with us. It looks positive. We're setting up meetings. We sent it to pretty much every legislature person. We sent it to every senator. And we've sent it, just out to all the advocates because we think it's as important for government to act as it is for people with disabilities to not just sit back and say, this is what's going to happen, but to be proactive and, engage their policymakers and, tell them how important this is for their life and for their
Javier,
family.
I do think it's important. I want to talk with you again. You seem like it's a little bit early in the process right now, but I'd like to get a follow-up to find out exactly what the Murphy administration did, what senators and assemblymen have taken an interest in this, and see if we can't get some action. This is extremely important. So I really appreciate your time in talking to us.
Thank you for your time, Larry, and thank you for, having us on.
Javier Robles, professor, Rutgers University. When we come right back, building a better port system in New Jersey. That's next.